I'm 20 years old and I was wondering what I could do to tighten the skin under my eyes. I have really bad sagging skin under my eyes and really bad wrinkles. Whenever I smile, the wrinkles get worse because I have so much loose skin. I just don't like my age and it's depressing. Please help.
Thank you for your question. At 20 years old, it's interesting you've come to the conclusion that you have a lot of loose skin that's causing wrinkles under your eyes. Well, the photos you submitted are certainly very helpful. And I can tell you that it's unusual for a 20-year-old to have loose skin. Loose skin is usually something that is an age-related change. It can present in younger people if there is a lot of eye rubbing, allergies, sinus problems, and other things, or skin issues that can accelerate the lid skin from getting thin into getting thinner. However, one of the things I did notice on your photos is an area of puffiness under your eyes. So to help you at least get a sense of the things that are making your eyes look a certain way, in addition to the appearance of wrinkles when you smile, just to be aware that it looks, based on those photos, that you have something called lower eyelid fat prolapse. Now, if you've been doing research on the web and you look at yourself and you notice that your eyes are puffy on a pretty regular basis, then you'll learn that there is this problem, and the puffiness is caused by fat that's behind the eyelid that pushes forward. Now, the most common factor that's responsible for this is genetics. Now, if there are other factors such as sinuses and allergies, it tends to make the fat pockets look a little more swollen. And if those are associated also with eye rubbing, then yes, it can make the skin thinner. So when someone like you comes to my practice, we do a step-by-step evaluation of the elements that can make the eyes look like they're tired. And addressing the wrinkles is part of that evaluation. So you may want to consider something to address the puffiness. Now, if this photo is just an isolated time when the eyes are puffy and most of the time they're not, then this information is not going to necessarily be relevant. Now, as far as loose skin, there's also an understanding to differentiate between loose skin and thin skin, or thin skin that has less volume underneath. Now, again, at 20, this is the time in your life when your skin is going to be at its best and you're in this bloom of youth. So you may want to consider some minimal interventions such as the use of topical creams and moisturizers to help protect your skin. And you may want to see a specialist to get an evaluation on why the skin is thin, and most likely with your skin type being a darker skin type, usually the skin type tends to hold very well unless there are other environmental allergies and other factors. So to summarize my perception of your skin issues, you may want to be conservative about any topical treatment for the wrinkles. In our practice, we actually have a skincare line, and one of the popular products that we offer is something called Eye Rescue Cream. And it's a combination of moisturizers and some active ingredients, and it's pretty well tolerated. But there's a lot of eye creams on the market that you may want to try first, of course. But that's basically one of the key elements of helping skin that appears wrinkled. And then take a look at your eyes in the morning, the evening, and see if it trends towards being puffy more often than not. If it does, then you may want to consider some type of aesthetic procedure. And if you think 20 is a little young, it is young, but a lot of my patients who have this procedure well into their 30s will say, I've had this problem since I was a teenager. So with modern technologies and techniques, it's something that can be addressed. So I hope that was helpful, and thank you for your question.